Unfortunately, despite all these research projects which have looked at infant deaths over the many continents, we are still not yet in a position to identify those infants who are at greater risk. So it is important that all parents consider how best to take measures to minimise the risk to their individual child.
The safest place for a baby to sleep at night during the first 6 months is in the parent's room in a cot. It is particularly dangerous to fall asleep with a baby on a couch or armchair. It is important to always place the baby on its back, with its feet towards the bottom end of the cot. This is known as the feet to foot position and helps to prevent the child wriggling in under the covers or bedding. When choosing bedding, you can choose between blankets or baby sleeping bags. If using a blanket, position the blanket no higher than the baby's shoulders and ensure that it is tucked in firmly and securely on all 3 sides. If you have chosen to use a baby sleeping bag, it is still important to follow the same advice, placing your baby on its back in the feet to foot position. Choose the right size and tog value for your baby and for the time of year. Ensure that the sleeping bag fits securely round the neck and that the baby's head could not slip in underneath. Choose the correct size according to your baby's age and weight, and look at the manufacturer's guidelines as they all vary. Babies can overheat because of too much bedding or clothing, or because the room is too hot. If you use blankets for your baby, please remember that 1 blanket folded in 2 now counts as 2 blankets. You should also remember that babies do not need hats when sleeping indoors, unless you've been medically advised to use one. The ideal room temperature for a baby's sleeping environment is about 18 degrees. If your baby is under 6 months of age and you discover that they have accidentally rolled onto their tummy during sleep, gently turn them over onto their back again. Some research suggests that it is possible that using a dummy when putting a baby down to sleep might help to reduce the risks of cot death. It is important to note that the dummy should be offered for every sleep, including daytime naps. And if you're breastfeeding your baby, you should wait until breastfeeding is well established before offering a dummy. This is usually about 4 weeks. Don't force your baby to take a dummy, and don't coat the dummy in anything sweet. You should stop giving a dummy to your baby to go to sleep between 6 and 12 months of age. Breastfeeding may help to reduce the risks of cot death. Breast milk gives babies all the nutrients they need for the first 6 months of life and helps protect them from infection. Smoking in pregnancy and after a baby is born significantly increases the risks of cot death. Don't smoke or allow anyone else to smoke in the same room as your baby. It's best if nobody smokes in the house, including visitors. Do not smoke or allow anyone else to smoke in a car your baby is travelling in. Each year, a large proportion of cot deaths occur in homes where 1 or more adults has smoked. If you or someone you know have been affected by cot death, please do not hesitate to contact the Scottish Cot Death Trust.